Imagine the birth of a baby. On most accounts, this is a joyful occasion. Now think of that birth happening weeks or months before the established due date. This scene is still a miracle in the making, but is infused with fear and anxiety. Introducing a premature baby into the world is a scary experience, but in an experienced medical atmosphere, some of the anxiety can be taken away. Premature babies, referred to as neonates or preemies, are babies that are born before 37 gestational weeks that have potentially life-threatening medical conditions. Through the rest of this speech, I will present statistics on premature birth, pregnancies that are at risk, and how the field of neonatology works to nurse babies back to health. A full-term pregnancy most often lasts around 40 weeks, but anywhere between 37 and 42 weeks is considered within the normal range. Premature births happen between 28 weeks, which is considered high risk and very early, to 36 weeks, which is considered late premature and low risk. The birth of a premature baby is thought to be a rare occurrence, but in 2006, 12.8% of babies born were born preterm. This seemingly low percentage translates into about 500,000 babies each year. According to the March of Dimes, 70% of premature births happen within the late preterm period, which is within 34 to 36 weeks of the pregnancy. Still, 10% of births happen within 28 and 31 weeks and are considered very high risk. No matter what category a premature birth falls into, the neonate is still at risk for developing illnesses that can impact the child later on in life. The earlier a child is born, the more at risk they are for developing these extreme conditions. While premature births can happen in any situations, there are certain lifestyles and pregnancies that put you more at risk. Some pregnancies, through no fault of the mother, are thought of as regular preterm. For instance, when a woman is carrying a set of multiples, their doctor is usually ready for her to go into preterm labor. Studies show that women who have also had more premature births are likely to have subsequent ones. In other cases, a woman's lifestyle can result in premature labor. When women who suffer from high blood pressure, either lifestyle-induced or chronic, are very much at risk for delivering a preemie. However, women who use illegal drugs, drink alcohol, or take no concern for prenatal care are also extremely at risk for giving birth to a premature baby. Babies born under these type of conditions are very at risk for developing medical conditions that threaten their mental capacity, such as fetal alcohol syndrome. Prenatal care is one of the most important factors in decreasing the risk that a baby is born preterm. When a baby is born prematurely, they are raised into the neonatal intensive care unit, or NICU. The specialized department of the hospital works around the clock to nurse these tiny babies. The NICU employs nurses and doctors who specialize in neonatology. According to Dorland's Medical Dictionary, neonatology is the art and science of diagnosis and treatment in the newborn infant. Neonatology uses many medical advances in the NICU to make sure that these babies are monitored properly and around the clock. With the skill of trained and passionate professionals, preemies can be nursed back to full health and usually go home around their due date. As you can see, the birth of a premature baby is an event that should not be overlooked. Preemies are at risk for extremely dangerous medical complications. Neonates are usually born between 28 and 36 gestational weeks, but with the proper prenatal considerations and postnatal care, these babies can be nursed to full health. Premature babies are a blessing like any other child that is born, and their survival is truly a miracle.
Did that one record the